So yeah, Chuck, I don't know what your title is within one payer states, Chuck. I
I'm
must
I'm
admit.
I'm the president.
Yeah, and Chuck has been lobbying in DC for the Ro Khanna bill in hopes that single payer healthcare can be created as a domino effect, by making it easier for states too. So we'd really appreciate an update from.
Sure. Yeah, happy to do so. Rana, and Rana's on our board at One Pair States. And Yvette, good to see you. And you, Nurses Rock. Holly, welcome. Hi, and Sherry, and Zach. Hey, Zach, good to see you, man. Um, so I don't know who else is here, but just to give like just a thumbnail update, just to kind of keep people in the loop, we're still encouraging folks to continually contact your House members with regard to getting on as a co-sponsor with HR 6270. That's in the chat, HR 6270. And just this past week, we've been working at this for the better part of a year. We have a U.S. senator who's going to be introducing the companion bill. I can't say who it is because that's the agreement. That it's up to them to decide on the timing of it, but it's a beautiful relationship already. I can tell you that we're going to be getting hearings out of this because, of course, the Senate has Democratic majority, not in the House. And this is just simply going to elevate our work a whole lot and help with the grassroots. And I also indicated here that we're launching a national petition, co-introducing it with Social Security Works. Many of you know Alex Lawson at the sort of the fulcrum or the hub of multiple progressive organizations. And this is going to elevate our work even more so. And so, yeah, I'm just, you work at this for months and months and months, and 3, 4 things just clicked last week. You just never know when it's going to hit. And that's why you just have to stay at this work. My mantra is, it's radical hope. Always radical hope. Just keep at it, keep plugging. So, folks, if you could, again, just tap your members of Congress on the House side for now, and then you'll get more information when the Senate bill's coming out. And then we'll be having a hearing up I'll just say in New England. We'll just leave it at that. That's coming up. And yeah, any quick questions that you might have? I'm in DC, so I'm lobbying directly on Capitol Hill, and I can't tell you how big a difference that makes. I mean, it's great the nurses are in town, but most of our single payer groups do not have boots on the ground in DC. That's why I'm your eyes and ears on the inside, and that's your work is absolutely critical on the outside, if you will, to make sure that members sign on and that we build momentum for this so that the states can capture the federal dollars through waivers. It's about 50 to 70% of the total bill at the state level. We're talking about federal dollars, as well as many of you know, an ERISA waiver is also part of the legislation. Employee Retirement Income Security Act, ERISA, which would therefore require all businesses to participate. That's a critical piece, of course, of creating as close to a single payer system as possible at the state level. So thank you so much. Love you all. I'm a Connecticut Yankee, as you all know. I lived in Norwalk when I was a kid, and always good thoughts for people in Connecticut. Thanks for doing the work that you're doing. And I'll leave my contact information here. If anybody has any questions, you could just reach out to me, and yeah, I'll keep you in the loop on all things. Thank you so much.
Thank you, Chuck. Thank you.
Ciao, ciao. Have a great meeting.
Good to see
You
you
as
again.
well, Chuck. Thank you.
Ciao, ciao. Bye.
Well, I didn't expect to see Chuck here when I logged in. That's great.
He sometimes does a quick stop through our meetings just to report on the latest. And I'm glad he's kind of taking the hit for all of us dealing with, in Washington, D.C., directly with the legislative, representatives and senators. I sure would not want to be doing that.
I think, as he said, it makes a difference, right? You have someone who's an advocate who's there all the time. You know,
Right.
that does have an impact.
Well, they get sick of seeing my face up in Hartford, that's for
That's
sure. I know some who run.
and that's a good thing.
Yeah, badge of honor.
Yep. So it's okay too. Would you like to get started now, Rana? I think we've given enough time. I want to
Sure,
be respectful of Yvette's time as well.
sure. We have a little bio on Yvette. Yvette Flores is a dedicated community organizer with National Nurses United, where she currently staffs the National Medicare for All, um, Medicare Para Todos, and CalCare campaigns, beginning her community engagement journey with a focus on voter mobilization and civic education. Yvette successfully registered thousands of voters within her community. In recognition of her efforts, she was honored with the 2019 Kegley Institute of Ethics Wendy Wayne Award. And tonight, Wendy is going to talk to us about, I think, CalCare and National Nurses United initiatives. So welcome to remotely to Connecticut.
I love it. Thank you so much. Thank you, Holly and Rana, so much for giving me the time tonight. And thank you, Jen, for coordinating this. I do have a PowerPoint to share with y'all. I don't have share screen yet. If you
Oh,
wouldn't mind.
yeah, I'll make you a co-host and then you'll be able to share.
Nice. Thank you so much. I appreciate that. Should have given you a heads up a little earlier. Thank
Yeah,
you.
that's fine. And I did not put together this, this particular channel. My own, I usually let anyone share screens, but
Nice. Well, thank you so much. It looks like it's working. Does it look good on your end?
it
Wonderful.
does.
Thank you so much for the introduction, Rana. So hi, everyone. My name is Yvette Flores. My pronouns are she, her, hers, and I'm actually currently based out of Ohlone Land, otherwise known as Hayward, California. And I'm an organizer with the National Nurses United on our national campaign to win Medicare for all. And National Nurses United is the country's largest union and professional association of nurses. So today, I'm incredibly excited to talk to all of you about our plans for 2024 and how your group can possibly partner with us on them. And we're also excited to share our campaigns with you and hope that you will be interested in becoming partners with us. This presentation should take about 20 minutes, depending on how many questions you have. So with that said, I'm going to go briefly over our agenda for today. I'm just going to be going over who we are at National Nurses United. Then I'll share some of our campaign goals for 2024, what partnership would look like, what our support would be if you did decide to work with us on some of these plans. And at the end, we'll have some time for some Q&A and then some next steps. So first up, National Nurses United is the largest professional association and union for registered nurses in the country. We represent a whopping nearly 225,000 bedside nurses. We have members in all 50 states with affiliates in California, Minnesota, Michigan, and DC. And we pride ourselves on being a militant union. We organize with direct experience as caregivers in this broken and corporate-dominated system. So at NNU, we believe that all people should be able to get the care they need when they need it without worrying about costs. And the reason why that is because nurses see firsthand the effects of our broken healthcare system. And that's why they've been leading the fight for Medicare for all for decades. And although we are nurses, right, and we're leading the fight as nurses, representing nurses from all over the country, our campaign is completely volunteer driven. So you do not need to be a nurse or have any caregiving experience in your past to be able to join this movement. So in 2024, we have two main programs, and we would love to share and possibly partner with you after tonight's presentation. The first campaign is our Patients Over Profits campaign, which I'm going to talk about a little bit more in just a bit. And the second campaign is very exciting. It's our nationwide canvassing program to identify healthcare voters and to highlight the disconnect that Democratic elected officials have with their constituents when it comes to the issue of Medicare for all. And this is really exciting because this is our return to canvassing after COVID-19, right? This is still an emergency. COVID is still happening, but we're back at canvassing. So we're going to be talking about that a little bit more after I cover the POP campaign. So our Patients Over Profits campaign has taken a lot of inspiration from the No Fossil Fuel Money pledge that politicians signed to say that they are not going to take any money from the fossil fuel industry. The POP pledge is very similar because it asks elected officials and candidates at all levels of government, so from the local level, your local city council, school board folks, all the way up to congressional candidates, U.S. Senate candidates, and presidential candidates, to commit to not taking contributions over $200 from the corporate healthcare industry. That includes pharma, insurance, and for-profit hospitals as well. And we have created this pledge alongside a really broad coalition of organizations all over the nation who work on the issue of healthcare justice. And the reason why the pledge was kind of born is because that we know that in order to win real healthcare reform, we need to take on the direct relationship between healthcare corporations and our elected officials' campaigns, right? An elected official needs to be very aware of what it means to take money from these corporate interests. And so we've been focusing a lot of our efforts for the past couple years on this pledge. We've had over 150 politicians sign it from all levels of government. So from the presidential level all the way to the local level, we had Marianne Williamson sign it a couple of years ago, which was fantastic. And all of this, right, was made possible through our volunteer base who researched for politicians' contact information, then attended in-person events, and reached out digitally to ask politicians to sign the pledge. And this is a really great start, right? 150 politicians nationwide is great, but we really want to explode the growth of this campaign and get as many elected officials and candidates to sign this pledge. And so that's where all of you come in. If this is something that you're interested in, partnering with us on the POP campaign, we hope that you will adopt the POP campaign for your area. So since you know your local politicians the best and you have the best access to them, we believe that we can achieve the goal of really exploding the growth of POP in your area with your help. And of course, we would provide you with everything that you would need to run the POP campaign in your local area. So we have a really fantastic, robust volunteer research team that can help you look up information you might need for reaching out to politicians. We will also provide you with a great toolkit that has all of the resources you need in one place, such as email and phone templates for reaching out to candidates and elected officials. We also have spreadsheet templates. We also have really amazing tips that we've given you for the best practices to reach out to elected officials and candidates, and so much more. And finally, we will host monthly action calls to give you a chance to connect with other groups working on this campaign all over the nation. So at these calls, we will share the latest updates and the progress on the campaign. We'll also have some specific dedicated time for you to trade advice with other organizations and folks working on this campaign. And so the first of these monthly action calls is actually coming up pretty soon here. It's going to be on Wednesday, March 27th. So if you want to flag that in your calendar, that's the first one that we're going to be having. So that is the POP campaign. Now we're moving on to the really exciting one, right? The canvassing program. So something that we realized when we were planning this year is that Medicare for all and healthcare reform was a huge issue in the 2020 election cycle, especially in the Democratic primary, right? We had all these different presidential candidates talking about Medicare for all. And we need to make sure, right, that Medicare for all stays part of the conversation in 2024. And so that is a big goal of ours this year. We want to make sure that folks are talking about Medicare for All. We also want to highlight the disconnect between Dem electeds and their constituents. So Medicare for All attracts majority support across the political spectrum. And we know this for a fact because polling shows it is backed by 88% of Democrats, 46% of Republicans, and 68% of independents. And also, it is supported by 69% of Americans overall. So this is also backed by the fact that after the 2020 Democratic primaries, there was exit polls that showed that there was overwhelming support from the majority of voters for Medicare for All. But only about half of Dems in Congress support Medicare for All legislation, and even less in the Senate. So what we need to do is we need to demonstrate that there is wide support that exists for Medicare for All and give politicians the cover they need to finally support it publicly. And so, of course, we want to continue our work to highlight this disparity, but also we want to educate and we want to deepen awareness of Medicare for All within our communities. And what we know for a fact from successful campaigns in the past is that in order to build a really strong mass movement of people, we need to talk to people from different walks of life. And the best way to build a long-lasting movement is to have, build that movement one conversation at a time. And so that's what we're going to be doing with this canvassing program. That's why I'm so excited about it. And so what we plan to do when we're canvassing is we plan to, of course, set up these canvasses all over the country so we can talk to people about Medicare for All. And then after setting them up and having volunteers, meet up at different areas, we want to speak to folks to conduct an informal poll to gauge people's support of Medicare for All and their experiences with our broken healthcare system. And then the second thing we want to do is we want to identify healthcare voters who plan to prioritize the issue of Medicare for All and how they vote in 2024. And so after months of canvassing and hopefully thousands of conversation all over the nation, we will aggregate the data we collect into a widely released report on the broad support for Medicare for All. And we plan to publicize this report as much as possible and hope to get the attention of Dem politicians. And if we gather enough data in specific geographies, we will also release more localized reports to local and state media as well, depending on where we have high concentration of canvassing results. And so a little bit more about our timeline. So we are having a really fun and exciting weekend of action, April 6th and 7th. And our hope would be that your group would participate in that weekend of action in April, and that you would host canvasses whenever it works best for you between April and mid-July. And we would also ask for you to help spread the word about the report when we release it in August. And of course, I would come back and hopefully I'd have a ton more details before we release the reports in August. And so we really hope that your group would like to work with us on this program. You are all experts in your local area. All of you know the best locations, you know where are the best places to go and crowd canvas, and you know who would want to join these canvases. So if you are willing to host a Medicare for All issue-based canvas in your area, we would put those canvases on our national action map, and we would also help you recruit for them. And we would give you all of the materials, the support, and the training that you need. We also plan to host a series of training calls in early March. We actually just hosted a couple of them, and there is a recording that I can share with you that goes a little bit more in depth into what these canvases look like. And yeah, that would be the plan if you would like to partner with us on the canvassing front. So to wrap up, if your group does decide to partner with us on one or both of these areas of work, which we hope that you will, we will provide you with the following support. The big one is our monthly check-ins We would share updates on Patients Over Profits work, connect you with other national groups, and we would provide you also with a written toolkit that will have everything that you need for working on POP, our Patients Over Profits campaign, or on the canvassing campaign. And of course, you will always have one of us on the organizing team available for one-on-one support. So if you feel like you need a one-on-one conversation, you need someone to like bounce some ideas off of, or if you are trying to like work through a struggle that you're having, we're always going to be here to support y'all, because y'all are there, y'all have the knowledge and the intricacies of the political scene, where you are. And so with that said, this is the part where I would be happy to answer any questions if y'all have any questions.
I do.
Mhm.
Sherry, hi.
Hi, Sherry.
Question. So for instance, I'm going to a big business luncheon for minority contractors in I think it's in May. Now, is there money to take out an ad in a booklet or have a table? How does that work? So that because I mean, obviously, a lot of minority contractors are small businesses. They don't have health insurance. They can't provide health insurance for their employees, but they would definitely need to hear about this. So, what's the best way to get the word out with them?
That's a great question. What we would recommend is we can always try to set up something like this, like a presentation with them, if we wanted for them to partner with us on these campaigns. Now, if we just wanted them to participate in the survey, a great way is to ask for them to like share the survey in like a newsletter if they have a newsletter, or like email out the survey to folks. You could also, of course, have conversation with their leadership and see if, they would give you some time at one of their meetings or one of their conferences. Those are all like different ways that you could definitely go about it to try to get the survey, or to try to get them to partner on this campaign.
Okay. But in terms of print materials, ads, do you do anything like that? Like they have a program booklet. Do you put an ad in?
That's a great question. I am not sure about that one. I would have to
Okay.
get back to you on that. Yeah.
Okay.
And it would be, just so I get it right, it would be funds for like putting an advertisement in like a booklet or something like that. Okay.
Yeah. Or even, excuse me, if you have a, because obviously I'll go to the dinner, but what do you have like pamphlets or anything like that that I could hand out, or even if I table at the event, I could definitely hand it out. Even though I'm doing my job, I could also hand those out.
Yeah, no, we definitely have some really great handouts
Okay.
available. And so what we would do is we would send you our toolkit, and it has links to all of these different documents that we've put together, including we have this really great document on like small businesses and how it would be
Perfect.
helpful. Yeah, so that
Yeah.
one would probably be very, very helpful.
Yeah.
And you can access them on our toolkit, and you can share them however it is that you think would be the best way to share it with them. Yeah, that's a great
Okay.
question, Sherry.
Thanks.
And then I see, Holly, your hand is up.
Yes. So first, I do have a question for you, Yvette. But Sherry, we actually do have pamphlets and a trifold brochure on for Medicare for All Connecticut. So
Okay.
I can send you that.
Okay.
I'll have to have Rhonda do it because my computer crashed and I
Okay.
can't get into any of my Medicare for All drives yet.
Okay.
But sorry about that. So Rana can probably send that to you, or if I
Okay.
can figure it out by then, I can send you those. So if you
Okay.
ever need that, I can do that.
Great.
Yvette,
Thank you.
now of course, my question for you is, can we just definitely do the um patients over profits? Because I do go to the Capitol often. And like I said, some run, and I don't want them anyway. But I am familiar with a lot of legislators now, and if you sit in the cafeteria, you can get a million of them just to just say, "Hey, guess what? Can you sign this, or would you be interested in signing this?" So, I wouldn't mind doing that at all.
Yeah, of course. Whatever you have capacity for is what we'd recommend you to do. So if you just want to partner on the Patients Over Profits campaign, that's perfectly fine. The great thing about the Patients Over Profits campaign is that there's different ways to plug in too. So like you would be a perfect person to go and like talk to the elected officials. But if there was any like other folks that wanted to get involved and wanted to be a little bit more like hands off and just kind of in the background, you could definitely do like the research team. But I think the big thing that we realized in the last year is that if you're as organizers, if we're not in the area, it's hard to know like all of the political intricacies, and all of you are living it there. You're already doing so much amazing work every single day in, day out. And so all of you have the political context. You know where to find politicians on Saturdays and Sundays. You sometimes you'll know where they hang out. So we know that, y'all would probably be the best people to go out there and to like lead this campaign in your community. So yeah, you can definitely just adopt one or both of the campaigns. And if like as time goes by, because I know you're in the middle of a legislative session, if you realize that you have a little bit more time, you can definitely decide to take, another campaign on as well as time goes by. Yeah. And then I see
I was going to just offer to Shari and anyone actually, if we have electronic, PDFs of literature. I have a big printer and I can print stuff out for anyone who needs it. It's a big office color laser, and I'd be happy to do that. And it seems like, creating these, real paper literature out of these templates is something the Medicare for All Connecticut could do as our part in that, whether for the canvassing part or for the pop part.
Nice. I love that. I love that. Printer capabilities they're so important. So I love that we have someone in the team. Very cool. Are there any other comments, any other questions that I could answer?
There is a question in the chat from Joan. I'm not sure if you can see it while you're sharing your screen, Yvette.
Oh yeah, I see it here. General and national info is great. Several states, including Connecticut, have state legislation. Oh, that's a great question. We don't have any state specific like information. We have like broader information available that's applicable to multiple states. But if when you're going out and you're speaking to the community, if you feel like you need to have an additional piece of literature that talks a little bit more in depth about what's going on in your state, you could definitely add that to like your clipboard if you're canvassing, or if you're going out and reaching out to politicians, whether it be in person or over email. You could definitely include local information that you feel would be persuasive to that politician that you're speaking to. Yeah, so yeah, and our toolkit, once we like send you the link to sign up, and you'll get our toolkit, has all of those general handouts available for you as well. I hope that I did a good job answering your question, Joan. If not, let me know. And then is there any other question or comment?
Well, quick question.
Hmm.
So like you were saying, both political parties are interested regarding the Medicare for all. Everyone's concerned about this issue. Do you have that? Is that in a written format? Because people may not believe me if I say that. Like, okay, at this exit poll, it said X. Is there do you have that written somewhere? Is that part of the kit?
Yeah, we do. We have that available in our toolkit.
Great.
So you can access all of that information. We also have a really great link tree that we're going to make live in a couple days.
Okay.
And that link tree is broken up, and we have like one of the sections is just like fact sheets, and that's where you can find a lot of those polls that we reference in the exit polls.
Thank you.
Yeah, of course. And then Stephen.
Yes. Well, I just wanted to comment on this campaign. I think it's very well designed. When I'm not participating in various advocacy organizations, I teach community organization at the university, and this is really a extremely well designed campaign. You've given yourself, I think, your group a very good chance for success, and so I do like this idea of engaging state-based groups, and I was curious if, obviously, you're speaking to this group this evening. Uh, are you doing this nationwide in other states? I mean, I think that was sort of covered in your presentation, but I thought I would ask about a little elaboration on that to get an idea of the breadth of what's going on.
Yeah, of course. So this is our national campaign that we are currently facilitating. The only state that we have not included in this, in the outreach for this campaign is California, because we have a CalCare campaign currently going in California for our single payer legislation. So we have Bill AB 2200 that's currently going through the Assembly. And so we are going to have to get it through the Health and Appropriations Committees in the next couple of weeks, and hopefully to an Assembly floor vote and beyond. So all California is focused on that right now. And then, we're really looking at this campaign to build, the groundwork that needs to be built in order for us to have success with Medicare for All legislation when we eventually, have the numbers again. So yeah, that's a little bit more on kind of what we're doing. But anywhere else in the country where you think we should be going, or you have connections with like any Medicare for All groups, we would really appreciate for you to connect with us. And we'd be happy to present to anywhere that you think would be interested in adopting any of the campaigns.
And so then the idea is to build towards a national effort as well, just to clarify again.
Yeah, of course. So like right now, there isn't like feasible, I guess, Medicare for All specific legislation within the House. So our hope is that we build that groundwork and that we have a really good turnout in November. We get our House back. We get, all of the political pawns, right, lined up, and that we will have activated that base so that we're not focusing on activating the base, and we're more so focused in mobilizing people to win Medicare for All, right? So that's the idea as of right now.
Excellent. Well, as I say, your strategy is extremely sound, and I wish you all the best of luck.
Thank you so much. We really appreciate it. And it's definitely not all me. There's a really great group of organizers that have been doing this for a long time that kind of all came together. And this was like our brainchild, like our little child. So yeah, we really appreciate it. And we appreciate all of you, of course, carving out the time today to hear about both campaigns. Cool deal. I don't see any other questions or comments. So with that said, I'm just going to move into our next steps really quickly.
Yvette,
Uh-huh.
I put a question in the chat. Have you shared your contact information?
Oh,
Maybe you have and I missed it, but
not yet. Thank you for
okay.
catching
Oh,
that.
that's coming up. Great. Thank you.
I got you. Yeah. I'll also put it in, I'll put my personal or my direct email in the chat. Here we go. And then I'll also cover other ways that you can reach out to us. Okay, so our next steps. So our next steps are to fill out our interest form. So we have our MFA partner form. What this will do is we'll put you on a email list that will give you specific updates for organizations. So any type of like new development that we have, or sometimes, we'll be shouting out like really great work that different organizations are doing all over the nation. We'll probably send you some information about that. So we recommend for you to sign up on that first. And then the second part here, let's see, going a little slow. So after filling this out, you will receive the toolkit as well. And then we also have our Plan to Win published on a Medium blog post. So if you want to kind of read all of the little intricacies of this plan and why we think that this is, a good way for, or a good path forward, we would recommend you to log on to the Medium blog post and to take a read at that. But yeah, thank you so much, everyone, for the time tonight. And I'll put all of these links in the chat, and I'll put our general info at email as well. But it sounds like, for the most part, that the POP campaign is going to be the one that y'all are going to be interested in. So I'm very excited to see you on those POP calls. Thank you, everyone.
Thank you.
Thank you, Yvette. I was trying to put the links in the chat so you didn't have to. I only got the first one in though. I just want to make sure that everyone is kind of aware of the other bills in Connecticut that are going on. So, well, does anyone else have any questions for Yvette? Any comments other than thank you so much? And I really look forward to doing the POP campaign. We did a lot of canvassing a couple of years back, and we did it with New Haven Rising, and it was fantastic. We got a lot of information. We did a lot of education, and it was a great thing. We just right at now, as you said, it's in a legislative session, but we don't have the capacity to do that currently. Hopefully soon we will. But I loved canvassing. I thought it was fantastic. And the majority of the people we spoke to were absolutely in favor of Medicare for all, 100%. And once people who weren't clear on what it was understood what it was, they were all for it as well. So it was more, if it wasn't a resounding yes, it was, well, I don't understand it. And then it was, okay, well, yes, that makes better sense financially and everything else. So yes, I am for it. So, it was it was good for me personally because it put me out of my comfort zone and it made me realize that I needed to know a little bit more in order to teach people too. So I learned more prior to going out canvassing so that I could educate better. So it was a really great experience for me. And I really recommend people do it because it was really cool. So thank you again, Yvette. It was great presentation. I really wish you the best of luck with your bill for single payer in California. I hope that you keep us posted because for a lot of things in Connecticut, we do say, well, California did this, New York did this, so we should do this. In fact, for our assets, income limits and assets for our Husky or Medicaid program, we are referring to California, which I do believe you guys got rid of those. So yeah, thank you. And we do refer to you. So please keep us updated because if you get yours passed, maybe there's hope for us yet.
We're hoping this is the year. We're fingers crossing that this is the year. But we'll definitely keep you up to date. And then if you need me to come back at any point, please let me know. And good luck on your legislative session. It's very hard to speak to politicians and hold composure sometimes. So it takes a lot of strength to do that. And so it's very hard work. But yeah, thank you so much. And I put all the information in the chat. Make sure you fill out our interest form. That'll keep you up to date on both the campaigns. But yeah, thank you all. I'm actually gonna log off if that's okay.
Of course. Yes. Thank you so much for your time.
Bye,
thank
everyone.
you.
Have a good night.
Take care. Thank you. You as well. Take care. Okay. So, Zach, do you have any legislative updates that you know about?
Well, briefly, I'm sure you're all aware of the Human Service Committee hearing on Thursday, right? And the medical debt bill I just attended a training on talking points with regard to that, sponsored by the Universal Healthcare Foundation, right? And so they have great talking points. Perhaps everybody's aware of it, and I'm just reiterating points that you're already tuned in on. But I do have, if you haven't received that, I do have an email from Rose Ferraro that would be useful. So I could forward that to you.
That would be great, because I was just looking at my email from Liz from CCAG regarding SB 395, an act concerning Medicaid budgeting methods and reporting of medical debt. That's one of the ones.
That's the one I'm talking about.
Yeah. But there's no talking point.
So okay, so I can send you the links to this.
Oh yeah, I missed it. Too many things going on the calendar.
Yeah, and the link, I think the link to the talking points is in this. I just want to be, yeah. Okay.
Oh, great. Thank you.
So just give me a moment and I'll get it. I'm a little slow with the email sometimes, but I'll get it to you.
You're not. No, you're not.
And
you're way too hard.
If we're going to talk about bills, can I briefly plug my full employment bill?
Absolutely. While I look for the other ones.
The hearing has already been held, right? And this is 5385. The hearing's already been held, but it's really a small bill in a sense to do a study of a job creation program. Folks related who are members of the Jobs and Human Rights Task Force are pushing this, of which I'm one of the people, and a bunch of us testified last week. We submitted testimony because they introduced the bill and very, very tight to get registered in time and so forth. But in any event, anything that folks can do to urge their legislators to push that one through would be helpful. That's 5385. That's it for me.
I didn't know about the testifying. I totally missed that one.
Well, sorry, Zach. So did we, unfortunately. Otherwise, maybe we would have had a few more testimony in there. But the bill got a positive vote out of committee. So right now, with the Legislative Commissioner's Office, and what we want to do is try to be sure it gets a floor vote in the Senate and then the House.
Thank you. Okay, so some of the bills, just to put these on your radar, because unfortunately, the hearings were already held yesterday, I believe. But there is a bill, SB 8, an act concerning drug affordability. Sherry, you may know about this already because of Connecticut Insulin for All. There's some not good stuff in that one as well. SB 307, an act concerning Medicaid coverage of biomarker testing, which is really important for people who have a history of cancers in their family and other diseases, so that it's just a simple test. Just pay for the test. And then this way here, people can be aware of things that they may have to get taken care of in the future and not be misdiagnosed over and over again. I mean, it saves money in the long run. Why they won't cover it is beyond me, just like other things. This bill is also important, SB 308. I don't know if you guys are aware, but there are only 2 wheelchair repair companies in the country. 2 in the country, because they've all purchased each other. So there's only 2 left. And they're very understaffed, and they sell all of these very expensive wheelchairs to people, but yet if something breaks, there's no one to fix them, or they take forever to fix. And if someone has a disability and a mobility issue, they're stuck without a chair for quite some time. So there was a bill, SB 308, an act implementing a task force for recommendations for wheelchair repair. to see if there was anything that they can do. I don't know, these are just bills that Sheldon would like everybody to have on their radar. SB 367, an act concerning a study to maximize Medicaid reimbursement for the Yukon Health Center. HB 5374, an act concerning annual inflationary rate adjustments for nonprofit human service providers. These are all effective for people's health and health care, because human service providers are pretty much anyone who has lived in an urban area goes to their nonprofit human services provider. People like me who are low income and or disabled go to a nonprofit human services provider. So, you know, they're very important to our healthcare. This one is extremely important for those of us who use the Department of Social Services. HB 5455, an act concerning the efficiency of the Department of Social Services in determining eligibility for medical assistance and responding to requests for information or assistance.
Should I be worried about that word efficiency?
No.
Okay.
No.
Sometimes
it's their efficiency.
Yeah.
It's their efficiency and lack thereof.
Oh.
Yeah,
Okay.
it's about them and their issues with their efficiency and their response time, and the fact that they have not given proper reports and they have not properly tracked data and things like that. I'm sorry. Go ahead, Zach.
Yeah, this requires them to do a study, in effect, to improve their procedures, so far as I can tell.
Mm-hmm.
Quick
Correct.
glance at the bill. So
yes,
it would seem warranted.
Absolutely.
If they're anything like they were 30 years ago when I briefly worked for them.
It's worse. It's worse. It's much worse. It's much worse. It's much worse. Trust me.
Doesn't shock me.
I'm in this position now. Trust me, it's worse. So if you feel like you have this is something that you're passionate about, even though the public hearing has happened already, you can still give written testimony and submit it through the Connecticut General Assembly website. There's two more bills that are on the healthcare horizon here. HB 5456, an act concerning federally qualified health centers. I'm not certain what that's regarding, but it is in this email as well. HB 5459, an act increasing rates of Medicaid reimbursement for certain providers. So we know that a lot of people need to have their rates increased through Medicaid. That hasn't happened in quite some time, at least a few years, I believe. Isn't that correct, Zach? It's been a few years since some providers have had their Medicaid rate reimbursement hired, or whatever that word is.
Increased, yeah. That's increased. My understanding, yeah.
Yeah, it's been a while. So yeah, these are some bills just to keep in the back of your mind. And if you want to look them up and get more information, that would be great. And if you feel like it's something that affects you and you can write testimony for it, please do so. And please submit it, because you can always do that and submit your testimony. It doesn't have to be only until the hearing. You can do it afterward, which is what I've been doing, because I have not been able to do public hearings. I just can't stay on the phone for that long. It gives me a headache. So it can help, and it will help. Every person's story helps. So go ahead, Zach.
I might say one thing in regard to that. The closer you can upload it in proximity to the hearing, the better, right?
Mhm.
I am aware that there's no limit necessarily on submitting it, but the further from the hearing time you submit it, the less likely it is to be read, have an
To
impact.
be read, right.
Yeah,
Thank you
well,
for saying that.
and so on. So
No, thank you for saying that, Zach. I appreciate it. I do. I do. Um, let's see, when was the peer support? I'm trying to just think, oh, this one's coming up tomorrow. So you actually can still send in testimony, but I think you were supposed to register by 3 yesterday. So this one is SB 370, and it's an act concerning peer-run respite centers for persons experiencing a mental health crisis. So I have the full information. SB 370 will establish 8 peer-run respites throughout Connecticut. It would include 5 regular peer respites, 1 BIPOC peer respite, 1 transgender, queer, or questioning intersex plus peer respite, 1 Spanish-speaking peer respite, and it will also create a peer-led technical assistance center to support program implementation and sustainability. So you had to sign up by today at 3, but you can still send in written testimony.
that hearing is going on tomorrow, I gather.
Tomorrow, yes,
Right,
tomorrow at 11 a.m. Yep. But that's also a really important thing to give another layer to the mental health crises that we're having and not having enough services and providers and hospital beds, which hospitals are not always the answer. Some people do worse, in fact, they say, and statistics show that hospital and hospitalization sometimes increases a mental health crisis for some. And that's why it's better if others go to a peer run respite where it's more of a house and home kind of setting, and you talk to a peer instead of a clinical person who is more interested in the medical model instead of just sitting down and talking to you and speaking to you as someone who's been in the same situation. So that to me is also very important. Mental health is a part of your whole health. And mental health justice is health justice. So that's important to me as well. Any other updates anyone has on the legislative session or anything else that you'd like to talk about in general?
I think we're good.
Okay. Sherry, you can always send me an email and or Rana or info@medicare4allct.org. And we can send you whatever you need to do tabling or anything. Or
Okay.
like Rana said, he
Yeah.
can meet you somewhere, or I can go to her house and bring it to you, or say,
Yeah,
you know
we
what I
can
mean?
figure
So
out something.
yeah, yeah.
Okay.
So
Thank you.
if you ever need it, please reach out, and I have presentations ready to go. So if you
Yep.
ever need that, please reach out. We're always here.
Thank you.
Okay. You're
Yeah.
welcome. All right, guys. Thank you so much for being here. We appreciate you all, and we will see you soon.
Thank you.
You're
excellent.
welcome.